the government had projected that by around this time, at least 10,000 cases of COVID-19 would have been reported in Kenya. The statement, while alarming, saw Kenyans rush to buy masks and sanitation tools to fight COVID-19. But now, 2 months in, only 400 people or slightly more have been infected. So have we dodged the bullet or flattened the curve? Well, joining me now is Mater Hospital CEO Professor Dominic Mwenja, who's speaking to us via Skype this evening. And good evening to you. Thank you very much for joining us. So the latest statistics are that there are about 21 deaths owing to COVID-19 in Kenya, which may be in the region of 5% of those infected dying, and that's among the top in Africa. What do those numbers tell us?
Hi, Anne, and hello, Kenyans. The numbers are telling us that we are within the trend that we see in the rest of the world. If you look at the numbers that are coming from the US and other countries, the death rate is much higher than we are. The mortality rates are much way higher than we are, up to about 15%. So the estimations that we had based on the earlier projections, what we have seen is that what the government has done over the last 2 months really has worked in terms of getting our people to do social distancing. The containment that we have seen has worked, but I wouldn't want Kenyans to relax and think that we have actually, we have escaped this, because we haven't. We still have many more opportunities for more infections, and as we go into more mass testing, we'll see more of our people being positive. So we need to be vigilant continuously and follow the guidelines that we are getting from the ministry, from HWO, and also from all other professionals that we've been listening to and reading about from the rest of the world.
So your opinion is that it's too early to tell, and if we do actually do mass testing, then those numbers could be closer to the government projections?
It is too early to tell. As we test on more and more people, then we'll be in a position to tell how far we are going. Okay. But we also have to look at some of the modeling and the assumptions that are going into the models. If you look at the earlier infections in this country, which came from the people who came from other countries, if we compare Kenya and the US, for example, you find that US has probably about 30 international airports, and the slowest airport in the US is probably 10 or 20 times higher, busier than Kenya, and therefore opportunities for infections from the very onset of COVID-19 were much lower and were supposed to be much lower in this country, right, because we didn't have as many people coming from China, from Europe and other countries. Okay. And therefore, we can't quite use the same model that we use in some of these other countries with very busy airports and so much international travel, right, to project the same here. But it's good to be vigilant, okay, and to know that our people should not relax at all.
All right. Shockingly, we're almost out of time. So very briefly, sir, if you would, for the next 3 or so questions. So we're seeing more cases of community infections in crowded areas like Kawangware and Isli. How do you contain such a situation? I mean, where are these people to go to begin with? We live in such close proximity to each other.
That is our biggest fear, Anne, and especially for highly congested areas with community infections. And therefore, I would ask our people to make sure they are on guard. The government not to let restrictions relax. We need to make sure that our people are segregated in terms of the curfew that we have imposed. You see what's happening in Mombasa, in the Kawangware now with 20 patients. 20 cases. Yeah, Isli, I think we have about 10 or so. Actually, 21 in Isli. So social distancing and making sure that our people are washing their hands and using masks all the time when they are together. But it is not easy to get our congested areas to be 100% right. COVID practice. You see, when you have a lot of people in a very small area, what we have to do is to make sure that they are social distancing when they are outside. And when and if we do quarantine our people, we have to make sure that as we quarantine them, we have good conditions where we quarantine them, so there is no risk of people escaping that we saw last time.
Right.
And also that those who would like to be tested do actually come out to get tested,
okay,
so that we can know the amount of infections that we have in our community.
Right, Professor, we're out of time. But as a private hospital CEO, do you believe private health facilities have a responsibility to provide subsidized treatment and to any possible COVID-19 case?
Yes, we do. And we've been working very closely with government, the Minister of Health. We've been working very closely with them. But for us in private hospitals and non-profit hospitals like Mater and others, our biggest cost is actually the PPEs. PPEs carry the most cost. Treatment is not as expensive as the PPEs. So we have to work with government, and we are asking government, as they get these PPEs from the National Fund, and from the likes of Jack Ma and other well-wishers, they'll be able to share that now with the private hospitals and especially the non-profit hospitals, so that we can also lessen the burden on the government institutions that are dealing with the patients who are COVID positive. Finally,
one epidemiologist has said to me that our infection rate or the reproductive number in Kenya appears to be less than the global 2.5%, somewhere in the region of 1.9% or even less. Do you agree with that assessment? And is it possible at all that Kenyans or Africans have a more resilient immune system because on a daily basis we eat fairly more healthy than the rest of the world, and beyond that we're always exposed to respiratory conditions because of the crowded spaces in which we live? Is it possible that that could be happening?
Those things are possible, but we cannot use those to actually relax. It is true we have about 1.9% infection rate against those who have been tested. But this number is going to change as we test more and more of our people. And therefore, we are encouraging our people to make sure that we get tested and more of them get tested, because that number will change with more and more testing that we are going to do, and especially in most of our congested areas.
Thanks very much, Professor Mwenja, for speaking to us. Dominic Mwenja of the Mater Hospital. Stay well and safe. And we're going to take another break. When we return, we're discussing the never-ending politics of Nairobi County. We speak to Speaker Beatrice Elachi and lawyer Kamodo Waiganjo after this.